Hello everyone and welcome to SCNM's webinar. We're very excited to bring you this interactive online experience that will let you learn more about reversing and preventing disease with nutrition. My name is Eve Belotis and I will be your host for today's webinar. During this webinar, you'll be hearing from Dr. Paul Mittman, SCNM's President. Dr. Mittman's presidency began at SCNM in 1999. Throughout his tenure, the college has consistently improved the quality of its education and patient care, contributed new knowledge on naturopathic medicine through research, expanded its outreach to medically underserved communities, and established itself as an innovative, dynamic, and caring community of healers. Dr. Mittman sits on a number of local community boards in the Phoenix area, as well as the Association of Accredited Naturopathic Medical Colleges and the New York Association of Naturopathic Physicians. Dr. Mittman earned his DA from the State University of New York at Buffalo, his Doctor of Naturopathic Medicine from National College of Naturopathic Medicine, and a Doctor of Education from the University of Pennsylvania. Throughout his career, he has been active in licensing efforts and other ways to advance naturopathic medicine. Over the years, numerous organizations recognized his contributions to the profession, awarding him the AANMP's President's Award in 1990, the AZNMA's Physician of the Year Award in 1999, the Spirit of Rotary Award in 2003, and the AANMP's Physician of the Year Award in 2007. In 2009, Dr. Mittman received a great honor when he was chosen as a Piper Fellow. So we're very fortunate not only to have Dr. Mittman as the president of SCNM, but of course as our presenter for today's webinar. So once again, thank you so much for attending. We hope that you find this presentation both interesting and informative. And with that, let me turn it over to Dr. Mittman.
Thank you. Thank you, Eve, and welcome everyone. I really appreciate the opportunity to be here with you today. So who would have thought when we were planning this talk that this would be so topically relevant? It's very important because the central role that nutrition plays in naturopathic medicine. On the other hand, I think that you probably would be, everyone would be familiar with the, with the news that came out yesterday on a study that was done in Spain. And the study that I'm referring to looked at an evaluation of the Mediterranean diet on cardiovascular disease, stroke, heart disease, heart attacks, and then all-cause mortality. And what was interesting about the study was that, first of all, it had to be stopped. Now, there are many clinical trials where you run into problems where the trial has to be stopped, but it's actually pretty rare for a study to be stopped because the effects are so significant that the researchers considered it unethical to continue the study without sharing the results so that other people can benefit. So what were the results? Well, basically, this was a study that looked at over 7,000 subjects, 7,447 subjects to be precise, who enrolled in the study to look at the effects comparing a Mediterranean diet with a low-fat diet. And it was interesting because I think we'll talk a little bit more about that. But let's talk about who the subjects were. First of all, they were any man between 55 and 80, women between 60 and 80. And as I mentioned before, there were 7,447 people enrolled in the study. So this is a big study. And they had to be at risk for heart disease, which meant that, number one, it could be that they had type 2 diabetes, and that was sufficient to enroll them in the study, or they had to have 3 other risk factors, not including diabetes. They were smokers, some combination of one of these, smokers, high blood pressure, high LDL cholesterol, low HDL cholesterol. They were overweight, or they had or obese, or they had a family history. So any combination of three of those risk factors. And what turned out was that the study showed a 30% decrease in what they called endpoints, which was either a person dying, a person having a heart attack, or a person having a stroke. That was the endpoint. So a person, and what they found was comparing the Mediterranean diet to the diet that was considered a low-fat diet. They found this very dramatic decrease. And so, just to be precise, there were two arms of the Mediterranean diet. Now, I imagine that most of you are familiar with the Mediterranean diet, but let me switch screens, and hopefully you'll be able to see the screen in front of you there, which has, from the Journal of the American Medical Association, the New England Journal of Medicine, rather, the summary of what is basically in the diet. The Mediterranean diet has been around for the last almost 2 decades, where it was first observed that it seemed like a paradox that people in countries like France and Italy and Greece had actually lower rates of cardiovascular disease than we do in Northern Europe or in the United States, even though there are higher rates of smoking in those countries, and there are higher rates of alcohol consumption, and certainly plenty of cheese consumption. And so in looking at what comprised the Mediterranean diet, some of the common features was, number one, that many people did drink. So alcohol is actually part of the diet for those who did drink. Olive oil was a prominent part. Fresh fish, and a high reliance on fresh fruits, vegetables, legumes, and small amounts of grain. What was excluded from it was red meat, and particularly fatty types of meat. What would be allowed would be white meats like chicken, pork, turkey, and I mentioned fish. And you can see there what would be the recommended servings. And then discouraged were things that were not part of the diet, was soft drinks, sodas, processed grains, pastries, cupcakes, muffins, those kinds of things, margarine and other kinds of spreadable fats, and then again red and processed meats. In the two arms of the in this study, there were two types of Mediterranean diets. One was a diet that was supplemented with olive oil. You can see there's a lot of olive oil there at 4 tablespoons per day, or walnuts. And the amount of walnuts was about a large handful of walnuts, and that's described there in the study. Now, what did they use for a control diet? They usually, when you use the word control, you're usually talking about a randomized control trial, which is usually a double-blind study. In this case, when it comes to a dietary intervention, you can't really have a double-blind study, which would mean that if I were a participant in the study, I wouldn't know, what kind of diet I was on. That would be, you'd have to be more than just blinded to it. It would be very hard. You'd have to be taste blind also to not know what you're eating. And so in this study, for the control group, which is considered the sort of usual standard, so in the United States we refer to the SAD diet as the standard American diet. And in this diet, they picked a peculiar control group, which was a low-fat diet. And if you look at it, that's a very low-fat diet. Unfortunately, you'll see when we get to the results that the study really compared a Mediterranean diet to what was more similar to a standard American diet. So what was so significant about this study was that we have in the study a significant decrease, and I'm showing you here with my cursor, with the number of events. And this is the control diet here, 109 events, heart attacks, deaths, and strokes, compared to subjects either on the Mediterranean diet with walnuts or the Mediterranean diet with extra virgin olive oil. And this number is significantly higher than these two, which you could see here in what's called the p-values. The p-value gives you what is the possibility that this is simply a random finding. If we dig a little bit deeper into it, we'll find out that really it was stroke that had the most, that the diet had the most effect on, because usually the p-value for it to be considered statistically significant has to be a smaller number than 0.05. So you can see here the overall number of events, but particularly the stroke compared to myocardial infarction, which means heart attack, or death from cardiovascular causes, such as a cardiac arrhythmia, or death from any cause. See, these numbers are greater than 0.05, so this is 0.1. And this gives you an opportunity to say, well, what are the odds that this is purely random? So here it's 0.15, or about 1 in 6 possibility that this is just a random thing. Whereas here with the Mediterranean diet with extra virgin olive oil, we could say that it's 9 chances in 1,000, much smaller number than these here. And I point this out because one of the important outcomes of going to a medical school and to a naturopathic medical school is to be able to look beyond what you read in the newspaper, what you hear on the radio, and what you see on the television, which makes very bold blanket statements that the Mediterranean diet prevents heart disease, whereas here we can see in more detail that it really is specifically around stroke. The other thing that's important from a critical thinking standpoint is that even though the Mediterranean diet is being compared to a low-fat diet here, when we look at the outcomes, the people in the low-fat diet were not given the same instructions or the same level of instruction, and so really the amount of fat that they were consuming was still greater than 30% fat calories, which is really pretty close to a standard American diet and not really a low-fat diet. I'm going to go back to our presentation here, leave the New England Journal of Medicine. So take a moment and let it sink in that here was a study published in the New England Journal of Medicine, which is probably one of the 5 most prestigious journals in the world, that showed here is an intervention, could be considered a treatment, that lowers a person's risk for cardiovascular disease, even though if we were to restrict it to stroke, it's still a huge number of people, by 30%. Could you imagine, those of you who are listening to this webinar, could you imagine if there was a drug that could decrease mortality and strokes and other incidents by 30%? That would be a blockbuster, more than statins, more than anything that we have right now. Not only that, but it would spare hundreds of thousands of people in the United States alone from these severe chronic diseases, and it would save our country, and certainly other countries as well, billions and billions of dollars. Because these types of diseases, chronic degenerative diseases of lifestyle, consume about 80% of the more than $2 trillion that we currently spend on health care today. So think about the implications for approaching disease through diet. Here's a quote that you may also be familiar with, and it's particularly prescient given the research that came out this week. The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and the cause and prevention of disease. Thomas Edison said that over a century ago. Now, this was one of the quotes that I remember seeing that got me interested in naturopathic medicine almost 34 years ago today. Interest patients in the care of the human frame, in diet, and in the cause and prevention of disease. So Eve talked a little bit about naturopathic medicine, about naturopathic physicians, and naturopathic medical education. I'd like to elaborate a little bit on that because I think what we saw today in terms of the impact that changing a person's diet can have on the number one, cardiovascular disease, and number three, causes of death in the United States and in many developed countries. Of course, number two is cancer. Number four is diabetes. Think of the implications and think about who is going to be the doctor of the future. So Eve mentioned earlier that naturopathic physicians combine the best of biomedical science with the best of prevention, lifestyle medicine, natural and alternative therapies. We do use synthetic drugs, but our primary preference is to treat people through prevention, and we're going to talk a little bit more about that in a second. Just to go over the course of naturopathic medical education, it's a 4-year program. You need a bachelor's degree with a pre-med background to get in. In the first year, our students go down a journey where they traverse 3 paths. The first is human biology, which includes anatomy, physiology, biochemistry, genetics, embryology, microbiology, histology, etc. And instead of having them in individual courses, which we had until 2010, all of those are blended into a human biology block, which rather than being taught by specific disciplines, so anatomy, and then the next day from 2 to 4 you have histology, and then you have physiology the next day, the courses are organized by organ systems. So all of the courses are team taught by the same PhD faculty from those different disciplines, but they orient their teaching through a systems approach. So when a student is learning cardiovascular system, they're getting it in anatomy. They're learning the physiology of the cardiac cycle and blood flow through the 4 chambers of the heart. They're learning it in physiology and in biochemistry as they're looking at action potentials and the electrical conduction system of the heart. You're getting the embryology of how the heart develops. So all of that is taught in the same time frame rather than perhaps having to wait days, weeks, or sometimes if a course isn't offered during a given quarter, having to wait for another quarter. So the human biology block is really the foundation for understanding human beings and health. And then in the second year, a lot more of that in disease when they study pathology. The second thread that runs through the first year is clinical practice. Starting in 2010, our students, first-year students, start their clinical practice on the first day of the first week of school, learning how to do physical exams, how to do a history, how to chart, and that progresses throughout the first and second years, where in addition to learning the basics of the physical exam, they're introduced to physical and clinical diagnosis, differential diagnosis thinking, and working first with each other, practicing on each other, and then with medical models called standardized patients. And then the third thread that runs through the first The first year is naturopathic principles and philosophy. Second year, more of the clinical practice, pathology, and then we really delve into what was introduced in the naturopathic principles and philosophy in the first year, which is the naturopathic therapies, a lot more around therapies. Third and fourth year, a lot of clinic, more therapeutic classes, and then also courses on organ systems like cardiology, neurology, pediatrics, organ systems or patient populations, gynecology, etc. So in some ways, I'm sort of generically describing a medical school. So what is it that distinguishes the naturopathic program from, I don't know, an allopathic, an osteopathic, or a chiropractic program? And what does nutrition have to do with that? And so here's kind of a jumble of all of these different modalities like homeopathy, botanical medicine, acupuncture, mind-body medicine, and all these organ systems, urology, cardiology. Is nutrition just one of many therapies, many tools that an ND has to use to treat patients and to prevent illness? Let's take a look at what really distinguishes naturopathic medicine, which is a conceptual model of naturopathic medicine. This is called the therapeutic order. It was first written about by Pam Snyder, Dr. Snyder, and Dr. Jared Zeff in the late 1990s. And so rather than see naturopathic medicine as just a bunch of different modalities, patient comes in, and I have at my disposal, I can write a prescription, I can use nutrition, I can use botanical medicine, acupuncture, manipulative therapies, mind-body medicine. How do I organize my thinking, and what role does nutrition really play in that? So off to the left, you can see naturopathic assessment. Naturopathic assessment means, well, first of all, an assessment or a diagnosis. Diagnosis is arrived at the same way that any other doctor does, through a careful history, a physical examination, lab work, and whatever other studies, imaging studies, are required to arrive at a diagnosis. A diagnosis, however, is just part of the naturopathic assessment. Let me give you an example. Let's say a patient suffers from irritable bowel syndrome. There are hallmarks of irritable bowel syndrome: pain, discomfort, gas, bloating, either constipation, loose stools, or some combination or alternating constipation and loose stools. On the other hand, once you arrive at that diagnosis, that's just a diagnosis: irritable bowel syndrome. It's simply really a description of the problem that the patient is experiencing. But what is it that underlies it? Is it that there's a food or group of foods that the patient can be sensitive to? Not everyone who's sensitive to gluten has celiac disease. There are a lot of antibodies that we can produce to gluten, which is in foods like wheat, for example. That could be part of it. It could be a dairy sensitivity or another food that manifests in gas and bloating. Interesting foods are brassica family. A significant number of people, really, even though broccoli, Brussels sprouts, cabbage are good foods, that could be a food that they're reacting to. Once had a patient with irritable bowel syndrome who, when I asked her, when do you remember your symptoms starting? Or I asked her, do you remember exactly when your symptoms started? She said, I remember precisely when my symptoms started. It was the day that the police came to my front door to arrest her father, for he had been consorting with a prostitute, and she and her sisters had been molested by this man. And her stomach symptoms started. She said she could tell me, she could describe the scenario when her stomach symptoms started. So while for some people it could be a food or some physical irritant, for other patients, when we talk about the naturopathic assessment, it could be a mind-body connection. It could be an event or an incident or a series of incidents that really cause the problem. After that, that gives us direction as to what we're going to do, what kinds of therapies are we going to use, and how are we going to approach each patient as an individual on the one hand, but at the same time to use a consistent approach, a conceptual model that we can apply from patient to patient regardless of the condition. And this would hold true, going back to the discussion that we had about cardiovascular disease and stroke. Think about how we would approach that using this conceptual model. And so before I give you a moment to just think about it, let me just make some definitions or share some definitions with you. We have therapeutic life changes, which I like because the acronym would be TLC. Therapeutic life changes, nutrition and diet, exercise, stress management, etc. The vis medicatrix naturae, which is a term that means the healing power of nature, first articulated by Hippocrates over 3,000 years ago. And the healing power of nature is that force within each living being that maintains health. In Chinese medicine, the word is qi. In Ayurveda, it's prana. In homeopathy, it's called the vital force. But it's that organizing principle or animating principle that really differentiates a living from a non-living organism. Just as an example, I cut my hand a couple of weeks ago slicing some vegetables. Not too bad, didn't need stitches, but it was one of those cuts that bled a whole lot. I used a little bit of cayenne pepper, which you wouldn't think would feel so good. It did actually sting, but cayenne is called a hemostatic, or it actually stops the bleeding. Put that on, put a Band-Aid on, and over a period of days without any other intervention on my part, I didn't take an antibiotic, I didn't take a drug, nor did I use any particular homeopathic, botanical, or nutritional supplement. My body somehow knew how to heal that up. And that's a pretty minor example. On the other hand, my father, about 10 years ago when he had bypass surgery, he didn't need medicine to heal from the surgery. He needed time, rest, and proper nutrition. But his body knew what to do. That's the vis medicatrix naturae. And so we can support that either by removing obstacles to cure, such as a really toxic diet, a very high-fat, high-sugar diet, too much alcohol, too much caffeine, etc. Or we can use specific therapies like acupuncture to stimulate or modulate the qi or the healing power of nature. Homeopathy falls into that category. Hydrotherapy, the therapeutic use of water, which I'm sure everyone has used if you've even just sprained an ankle or put a cold compress on a bee sting. It's not just that you're taking down the swelling, you're either driving circulation or bringing circulation to an affected area. And I would say biofeedback and mind-body medicine would fall into that category as well. Supporting affected systems, think about the role that the gut or the gastrointestinal tract plays in a person maintaining their health. So for example, patient comes in, let's say a woman comes in with vaginitis, and you're doing the history, and after careful history, you find out that 2 weeks ago she had sinusitis, had to take 2 courses of antibiotics, and came down with a yeast infection. Where do you treat? Do you treat just the affected area? The infection and the discomfort is all in the vaginal tract. Or do you affect other systems, either directly or indirectly related, by taking something as simple as probiotics and supporting the gastrointestinal tract? There's also ways that we can support the immune system, we could support the nervous system, the endocrine system, etc. Addressing structural integrity refers to either the integrity of the spine, or it could be removing, repairing a structural problem like a hernia repair, removing a solid tumor. So a patient with, let's say, prostate cancer and needs to have the cancer removed, or breast cancer and needs to have the tumor removed. That would be another example of addressing structural integrity. It's interesting, a lot of people will come in complaining of back pain, but really when you look at them carefully, you find that their pain really starts in their feet. The problem starts in their feet. You look at the way their shoes wear and look carefully at their gait or the way that they walk, and you can see a tremendous imbalance called pronation, which rotates the lower part of the foot and ankle, rotates the leg and the knee, and all of those forces end up torquing the lower back. So looking at structural integrity is another either direct or indirect approach. And then finally, treating the pathology, which could be giving a person a drug or some alternative to that. So you can treat a bladder infection with a drug like macrodantin, or you can give a person cranberries or cranberry juice, unsweetened, or an herb like uva ursi. Done in isolation, it's really just treating the disease or the pathology. Taken together, this is a way that a naturopathic physician can practice in a comprehensive, whole person way that addresses the root of the problem, which is determined by the naturopathic assessment. So what role, I talked in the previous slide about where's nutrition? Well, if you think about the curriculum this way, it's just one of many, many subjects. As it turns out, nutrition plays an important role. There are many hours and classes in nutrition. But if we organize all of that into a conceptual model, think for a moment, take a moment and just think about where is nutrition in this schema. Well, obviously, when it comes to therapeutic life changes, pretty much that's what the study that we started this talk with was really doing. The Mediterranean diet is an example of a therapeutic life change. Stopping smoking is an example of that also, but nutrition plays a particularly important role in that. So nutrition for therapeutic life changes is really something that transcends and crosses the boundaries of many, many diseases. Because when we look at a diet similar to or the Mediterranean diet or a diet similar to that, we're talking about a diet that's anti-inflammatory. And not only does it prevent those diseases that were articulated in the study, but it also, being anti-inflammatory, probably has similar effects on other chronic degenerative diseases, whether it's diabetes, cancer, arthritis, to name just a handful. So obviously, in naturopathic medicine, nutrition plays a prominent role in probably 80% of the patients that we see. How about in terms of the vis medicatrix naturae? Well, this is a different level of nutrition. When we were talking about what they found in the study, they were looking at so many calories from fat, from carbohydrates, this type of fat versus, a saturated versus a monounsaturated fat. Think about the role that nutrition plays in promoting the healing power of nature or the vital force. Is the food that the patient is consuming, is it health promoting? Is it vital? Is it alive? Or is it devitalized, processed, killed, manipulated, and genetically modified? Which is more likely to promote health? And so we can use it here, which is very common, or we could take it to another level. Supporting affected systems. We talked a little bit about the gut. Really the best way to get probiotics is from fermented foods. That would be one example. Avoiding certain foods that that a person might be reacting to is another example. Structural integrity. You know, it's interesting because for many years the thinking was that to build strong bones, you have to consume a lot of calcium. It turns out that really the most important thing is to consume a diet that renders the blood a little bit more alkaline than a diet that would make the blood acidic. Why? Because if you have an acidic internal environment, your body is going to try to buffer that by pulling calcium out of the bones. That's the first place that you get it, from the bones and from the bones around the teeth, from the periodontal area. So in naturopathic medicine, nutrition is a specific modality. And there I was just talking about diet. And in addition to that, we have specific nutritional supplements. We mentioned probiotics earlier. For the patient with irritable bowel syndrome, there are certain amino acids. They're either contained in food or there are certain amino acids that you can take. There are, for structural integrity, I mentioned calcium, which is not really being recommended now, but there are other cofactors that you can consume. And also for treating the pathology, we talked a little bit about, let's say, bladder infections. You can use vitamin C taken orally for bladder infections, or you can take that to a completely different level and use intravenous nutrients for patients who are extremely debilitated or very sick, such as patients with cancer. So this conceptual model gives you an idea about where you would see nutrition, but you can actually extrapolate that to many other naturopathic modalities. We started this talk looking at a study that was really, pretty groundbreaking. I think that when we talk about cardiovascular disease, stroke, and probably in the not too distant future cancer and diabetes as well, it would be hard for the scientific community at large to skip over the role that diet and nutrition plays and go right to drugs and surgery. And if you're looking for a career, as I was 33 years ago, where you want to be the doctor who is well-trained, who understands not just the causes of disease, but understands the true meaning of primary prevention and the ability to reverse disease, then I recommend that you take a look at naturopathic medicine. And even more so, I hope that you have a chance to visit the college and look forward to meeting you here. So thank you very much. It was really a pleasure speaking with all of you. And I am going to turn it over to Eve, and we will take some questions.
Great. Thank you so much, Dr. Mittman. That was very informative. So here's the question to get us started. Dr. Mittman, are you familiar with the book Nourishing Tradition? If so, what is your response to her focus on the importance of animal products in the diet, including butter, dairy, and meat? And if you're familiar, how does this compare with the study done on the Mediterranean diet?
I have to confess that I am not familiar with that book. However, the approach that you just described was first articulated by a dentist named Weston Price, and I imagine that that either the origins of the book or a lot of the original research came from Weston Price. I know people who follow that diet. In fact, two of the healthiest, thinnest people I know are following that diet. Here's my take on all the different diets that someone can follow. The most important thing is to be consistent. If you're going to do that, and I would say there's not nearly the volume of research. Most of that has been observational. So in other words, looking at different cultures that consumed those kinds of diets. So the Inuits or other nomadic cultures that were herding cultures and had access to a lot of dairy and meat, but not so much agriculture. You can adhere to one of those diets, but you really have to adhere. You want to do a low-carb diet? Fine, but you can't mix low-carb with sort of binging on carbs periodically. You want to be on a low-fat diet? Fine, but you can't be in the mushy middle. And I think in this particular study, what they found was that what they called low-fat wasn't low-fat at all, and that's the problem. That's where most people end up. Most people end up somewhere in the middle of all of those diets. And if the attendee is following that diet and their biomarkers are all good, in other words, their hemoglobin A1C for blood sugar, their cholesterol, LDL, HDL, their blood pressure is good, I say more power to you. The key as a physician is to be able to identify for each individual patient what is the best approach. For some people that might be great. For other people, the Mediterranean diet. For other people, a low-carb diet. One of the things that was really interesting, or for still other people, a very low-fat diet, like the Ornish or Esselstyn programs. What was really interesting in this study was that they didn't talk about weight loss. And most people, I think, really sabotage themselves by approaching a diet not so much as a way of life, and this is how I'm going to eat and live my life for the rest of my life, as opposed to, it's New Year's and I have to drop 20 pounds. Or, I've got that wedding in June and I want to be able to fit into my old tuxedo or suit or dress or little black dress or whatever it is. And almost without fail, that kind of approach it usually does not work out.
Thank you. Can you talk a little bit about what role you see nutrition playing in the treatment of mental health illness? And after that, also address a little bit what sort of training our students receive towards psychiatric care. We have somebody who's interested in treating psychiatric patients naturopathically. So if you can answer both of those. Thank you.
Nutrition plays a role in many psychiatric conditions. I wouldn't say that it would be either exclusive, the exclusive approach, nor would it be, going back to that naturopathic conceptual model that I showed. I would think that it would play an important role, but probably not necessarily the primary role. There are nutritional deficiencies that can influence mental illness, number one. There are foods that we take in, that we ingest, that have non-nutrient ingredients called excitotoxins that could affect a person's cognitive ability, their attention, and their emotions. There are foods that people can be reactive to. We see a lot of kids here on the autism spectrum, and a lot of them are sensitive to gluten and other foods. So it does play an important role. It's very important to make sure that you are working with the patient and the patient's support system in a holistic and comprehensive manner. So food can play an important role there, either for individual nutrients, for specific foods that they may not tolerate well, or for specific ingredients that may adversely affect the person. And then in addition to that, you need to work with their support system and use some of these other approaches, whether it's homeopathy or Chinese herbs or acupuncture or Western herbs, that you are looking at, are there other manifestations of the illness that need to be looked at. For people who are particularly adept at it, and here I'm not saying that this is, the primary approach to treating psychiatric conditions, but looking at subtle treatments like craniosacral therapy or myofascial release would be important as well. And then for naturopathic medical school, in addition to understanding the neurobiology in health and also in illness, our students understand the diagnostic criteria for psychiatric illnesses. And really, I think the important thing here is to know what is within not just the scope of practice, but within your scope of experience and abilities. I had a rule when I was in practice. I practiced for 25 years. My rule was that anybody who had either a psychotic condition, so bipolar disorder, schizoaffective disorder, or major depression, had to also be seen by a psychiatrist. And that was just my own working rule. And, it was always, a lot of times people think that, this is, I want to treat this way, I don't want to treat using conventional drugs. But sometimes either working together in a complementary fashion is important, or working with a practitioner who that's their sole area of expertise is a great way to make sure that you always stay focused with the patient-centered as opposed to being modality or practitioner-centered. And then students have opportunities in different clinical rotations for working with either mind-body medicine. We have some practitioners here in the Valley who focus exclusively as NDs on psychiatric illness. We also have opportunities in several drug and alcohol rehabilitation programs here in the Valley for our students to do clinical work.
Can you talk a little bit about whether NDs work exclusively with their patients, or if they find that they have to refer patients to MDs to complete treatment?
Both of those options are they're kind of an all or nothing, what I would compare to a zero-sum game. Either I have to do it all myself, which, there was a time when NDs were not well integrated into the healthcare system where that was pretty much the rule, mostly because other practitioners, particularly medical doctors, were not interested in working with NDs. Or, the option to that was simply referring the patient for somebody else to care for. In the last 18 to 20 years, I would say we've seen, really since 1993, when Eisenberg's study came out, also in the New England Journal of Medicine, on the prevalence and popularity of complementary and alternative medicine, we've seen the concept of co-management become much, much more common. And so it doesn't have to be either or. It's not just that the ND can do everything, or that the ND can only do a small amount. But there are patients who, I would say, for the majority of adults and children with serious chronic conditions, that the ND, as do other practitioners, works in a team to co-manage the patient. So let me give you an example. When I was in practice, I saw many, many patients with high blood pressure and elevated cholesterol. And most of them, when they came to see me, were on some kind of medication, some antihypertensive or some kind of lipid-lowering drug. My level of experience and comfort, particularly as I got into the administrative responsibilities here at the school, was that I always preferred that the person who prescribed the medication was the person who discontinued the drug or decreased the drug. So as a person's blood pressure came down from eating more of a plant-based diet, such as the Mediterranean diet, that I would communicate with the other physician and we would come up with a plan together. Not that, I would do my job and hand the person off, but it was something that we worked on together. And that was true for blood pressure, that was true for cholesterol, a little bit less so for cholesterol because that's not a very difficult medication to make adjustments to. But another example would be patients with diabetes. once they start eating well, you can almost predict that they're going to become hypoglycemic on their current dose of their medicine. So I think the big thing here is to look at healthcare of the future is going to be a team-based proposition. And for NDs, it's really important to work with patients in conjunction with other practitioners. And that's something that we emphasize here at SCNM.
Can you talk a little bit about the job market needs and demands for NDs both in North America and Canada?
The best source for that would be the U.S. Department of Labor, which projects above average growth among NDs. So that would be one, sort of objective outside of the profession source. Another is if you look at either the provisions of the Affordable Care Act or some of the major initiatives in the Affordable Care Act, there are two areas that are particularly promising for naturopathic physicians. One is the healthcare provider shortage. So in terms of workforce development, we just don't have enough people who can practice primary care. And naturopathic physicians can help fill that void. And so now NDs are working on Indian reservations and are eligible for loan forgiveness for working on Indian reservations. And I expect that the need for people who practice primary care, who are naturopathic physicians, is going to continue to grow. The other area is the practice of prevention. And really, just having more primary care physicians is not going to make a huge difference in the cost of health care. So for us to add another 30 million people onto the insured rolls is by itself is not going to drive down the cost of health care. What will drive down the cost of health care is the practice of prevention, particularly the kind of prevention that we talked about early in this in this presentation. We have a meeting at our board retreat next Tuesday with a gentleman from the insurance industry who is convinced that naturopathic physicians are going to play a very important role because basically the insurance industry is going back to a capitated form of health care. So a healthcare system has a certain number of people to take care of. This is the number of people and this is how much money you're getting. That's all you're getting. Deal with it. Well, the best way to deal with it is to keep the people healthy. And the best people to keep the patients healthy are naturopathic physicians. And so he is meeting with us to look at some of the partnerships that we can develop in the insurance industry with businesses and also with healthcare organizations.
Can you talk a little bit about residency programs for NDs, and specifically if there are opportunities for NDs to apply to surgical residencies?
There are about 50 accredited residencies for naturopathic physicians right now in the United States. That represents a residency opportunity for approximately 10% of the graduates in any given year. Obviously, that's not enough. Unfortunately, residency programs are supported by Medicaid dollars or Medicare dollars, and the Medicare dollars are strongly influenced by the American Medical Association, and naturopathic physicians are not eligible for the kind of residencies like surgical residencies or hospital-based residencies, with the exception of Cancer Treatment Centers of America has hospital-based residencies for naturopathic physicians, but they are privately funded. And so there's a significant movement in the naturopathic profession, I'm proud to say headed up by our Executive Vice President, Dr. Christine Gerard, to increase the number of residency opportunities, a number that we expect to see grow in the years ahead.
Thank you so much, Dr. Mittman, for joining us for today's very informative presentation. Dr. Mittman mentioned and encouraged that you come out and see the beautiful campus, SCNM's beautiful campus here in sunny Tempe, Arizona. And although you can do that at any point throughout the year, If you're out of state and trying to plan accordingly, I encourage you to think about visiting us on Saturday, April 27th for our Discovery Day or our day-long open house, where you'll have an opportunity to meet with current students, alumni, learn more about the profession, and tour our beautiful campus. This is a great way to really see and feel and experience all that SCNM has to offer. If you're local, or if those dates don't work, if that date doesn't work for you, there's always opportunity to come and get a tour of the school with one of our admissions reps, or participate in our Student for a Day program, which allows you to actually sit in on classes and shadow a couple of shifts in our medical center. So thank you so much for participating in today's webinar. If you have additional questions that weren't answered, please feel free to contact me. My email is listed there on your screen, or you can call me and we'll get your questions answered. Thank you again so much, Dr. Mittman, for joining us and for presenting this great information, and for all of you for joining us on today's webinar. We look forward to hearing from you and answering any other questions that you have. Thank you.